Doctors who had to break the news. What was a reaction that stuck with you the most? I worked in an internal medicine office and had to tell a patient that his HIV test came back positive. I asked the medical assistant to come get me as soon as he was checked in for his appointment, so he wouldn't have to wait very long for me in the exam room. I opened the door and he smiled and said, "I think I know what you're going to tell me." I nodded my head, yes, and he put his arms out to be hugged. He cried and we hugged. That was in 2016. I've retired from the clinic since. He connected with me on social media. His viral load is undetectable, and now he has a new job that he loves. Next story. I have to give pretty bad news on a frequent basis. Most people know it's coming. Last week in residency, I had to tell a mother that her daughter was going to die. She came in talking the night before and had surgery for a life-threatening problem, but we thought she would make it after. Halfway through the day, her vitals and labs took a nosedive, and it was obvious that our efforts had only temporized her, but we lost. She was intubated and peaceful, but she was young and had 2 small kids. We've all seen the TV drama style screams, pounding on the table, begging for someone to do something, sobbing. When it's real, it's so much harder. Her mom was crying on the floor asking me to take her organs to save her daughter. I'm not emotional, but that day wrecked me. I went to the bar after with my attending and we didn't talk. I try not to think about it. Next story. Not a doctor, but worked as a medical scribe. Basically went into rooms with a provider and listened to the story. Guy was diagnosed with very severe cancer via outpatient PET scan and told by their crappy oncologist to come to the ER, so someone else had to break the news so they could stay home. Anyway, I watched this otherwise cool provider take a 15-minute break after to go cry because this gentleman said something along the lines of, "I am so thankful you were here today to help me, and I'm so sorry that you had to be the one to tell me this." Next story. When I was a resident and training in the PICU, pediatric ICU, I had a family whose 3 sons were in a horrible car crash. One thankfully walked away with only a broken arm, while the other 2 unfortunately were admitted for severe injuries, and I was assigned to be their primary medical provider. It became clear after a few days one was going to make it through, but the other was not, and was officially brain dead. I remember sitting down with the family to talk about next steps as they wanted to withdraw care. Suddenly, the mom stopped me, hugged me, and said, "It's okay. We want to donate his organs before we withdraw care. The day he was born, I just knew I had to name him Valentino so he'd have a big heart. And now he can give the heart away to someone who needs it." I've never cried as hard as I did when they wheeled him to the OR for organ procurement, and I still tear up to this day. OP's got me tearing up a bit too. Oh man, this is not going to be an easy thread to get through. I guess this is a good time to remind people, don't forget to sign up to be an organ donor. You can make a huge difference in someone's life, and you don't need them anyway. Next story. Telling a very young patient that their cancer, which was assumed to be curable through surgery, was in fact not so because it had spread to the brain. It was a rare cancer that rarely spreads, that rarely affects younger people. Some people get all the terrible luck in the world. The patient was remarkably stoic, but one of the parents lost it. The tears, wailing, pleading, and breakdown isn't anything I'll forget. The rage against the system, the accusations of I must be wrong, and then the pleading and tears again. I think it's the fact I took their hope away from them. There's no happy ending to this story, but I'm the one who had to tell them. Years later, I can still see their faces and grief. It's burned into my damn memory, and it took a while to accept that perhaps trying so hard to forget would disrespect the patient's memory. I'm trained to deliver bad news and do it regularly. This one remains one of the only times where a case utterly emotionally broke me, and my supervisor saw my reaction and sent me home, told the department I'd be off for a few days. There are always those cases that stick with you forever. C'est la vie. Next story. ER doc. I just had a young lady die of a drug overdose. She was only 22. Her brother came as we were coding her, chest compressions. We had done everything, and there was no bringing her back. I asked if he wanted to be in the room when we stopped. He said yes. His reaction was heartbreaking. He screamed and cried and then picked up her body and whispered in her ear, "I love you so much. You're my best friend," and just held her and kept saying, "I love you." All the staff had to take a moment after that. I've done this for 8 years, and that was one of the saddest, most heartbreaking things I've ever seen. I'll never forget them. Next story. First year of being a doctor, a patient had an abrupt/very unexpected code and died shortly after we had just discussed starting a new round of chemo the next day. fully laughing and just hanging out with his family in the room not half an hour before he passed. It was the kind of experience that shakes you, makes you consider leaving medicine because you don't know if you'll ever trust yourself again. I lost it and spent 15 minutes ugly crying in a stairwell before I could bring myself to go to the family waiting room and tell them. But when I got there, they said they figured out what had happened. They were sad, but thanked me for at least making his last day a happy one, and hugged me. I slept on the floor that night out of exhaustion. Their reaction is the only reason I was able to peel myself up in the morning and get back to work. It's been years, but I will never ever forget it or him. It is extremely difficult to compose yourself like this family did in this kind of moment. Huge shout out to them. Doctors often work insanely hard just to have people yell at them when it doesn't go right. And it's fair, in a way. People are going to have big reactions around things that they need a doctor for. That's just normal. But that sort of thing really contributes to doctor burnout, which there's a lot of. Huge shortage of doctors, at least here in Canada. I'd like to say thank you to OP too for making that person's day a happy one. Of all the ways to go, it sounds like they had one last good hurrah at the very least. Next story. Just because this thread is a bummer, I'm going to tell a flip-flop story. I was with my mom when her oncologist got to tell her that her aggressive metastatic cancer with a low survival rate was responding incredibly well to treatment, and she was on her road to remission. Obviously, the reaction from her and I was huge. He quickly excused himself, but I could see he had tears of joy in his eyes. He had been her oncologist for almost 20 years at that point, literally watched me grow up. Amazing man, obviously cared deeply for his patients. Next story. Patient came in, 16-year-old girl, and had a rare type of childhood cancer that affects the thyroid. She managed to beat it at the time with no residual symptoms up until she came to me at 16 years old. I'm a physical therapist, for her weekly exercises. She wasn't my patient. I was filling in as a floater for the day. She mentioned how recently she had been feeling a deep, achy bone pain at night. At the same time, while assessing her, I had noticed some newfound painless lumps/nodules. Somehow, this wasn't caught by her previous provider. After I had explained what was going on, you could instantly see the click that happened in her head. We looked at each other silently and just didn't say anything. Just an intense, emotional silence in the air. You could see the tears really welling up. She thanked me. I sent her to her oncologist. She had stage 4 thyroid cancer. She knew she didn't have much time left. I was 26 years old at the time and scared crapless being so new in the game. It's weird. All of a sudden, I knew exactly what to do, and I still think about her until this day. That memory is forever engraved in my head. Next story. Delivered news to an older patient that her liver cancer was not operable and not eligible for loco-regional radiation or even palliative chemotherapy because of how far gone her liver function was. There were simply no more options. Her husband was in the room with her when our team delivered the news. As soon as we said our part, the two of them just held hands, rested their heads on each other, and they started crying. At that moment, I didn't even see them anymore. I saw myself and my wife. I barely held it together in that room. I still don't know how I made it the rest of the day without breaking down. As soon as I got home, my wife wasn't home yet, but I badly wanted to see her. I just sat and cried for a while after that. Next story. I had a young man come to the ED for pain. History of leukemia with a super high survival rate. Labs showed the cancer was back. When I went to break the news, he just smiled and said, "Oh no, it's fine. God will cure me. Can I be discharged now?" No one, including his family and his spiritual leader, could convince him to stay. God did not cure him, and in fact, saw him personally a few months later. Holy Opie, I thought saw him personally a few months later meant, OP, like he went to the doctor again. Nope, I don't think that meant the doctor. I think the young man instead saw God. What an absolutely brutal way for OP to phrase that. Next story. I'm a pediatric oncologist, so I've seen the full range of reactions, and all of them have stuck with me. But here's a story about the reaction I never saw. When I was a first-year pediatric oncology fellow, you did 2 months of what was called OCS, Oncology Consultation Service. This meant that you were the fellow on call to evaluate all patients with a potential diagnosis of cancer who came into the hospital. For example, a child with low blood counts and bruises seen in the ER, or a patient on the orthopedic service who had an unexpected fracture and lesion on X-ray that was suspicious for cancer. Once you helped to make the diagnosis of cancer, you would either admit the patient to the hospital where the fellow running the inpatient oncology service would take over, or you'd have them come into the oncology clinic, where they would be assigned to a different oncologist. You were typically the first point of contact, but in many instances you didn't end up becoming the patient's primary oncologist. You just moved on. One night I was called to the ER to evaluate a child with symptoms consistent with leukemia. No matter how much families are prepared or think they're prepared, the reaction that you get when you knock on the door, go into the room, and introduce yourself by saying, "Hi, I'm Dr. OP, and I'm from the Pediatric Oncology Service," is pretty much the same as you are clearly the person they dread seeing the most. This night, it was a 4-year-old little girl. I came in, introduced myself, explained why I'd been called, and told them that until we looked at the blood under the microscope and did additional tests, for example, a bone marrow biopsy, we couldn't know for sure, but that the ER doctors wanted me to come and consult. That didn't make the parents feel any better, but that was my job. I examined the child, and then headed up to the lab to look at the blood smear myself. Sometime with leukemia, you need more sophisticated tests. Flow cytometry, immunohistochemistry, chromosomal karyotyping, evaluation of the bone marrow specimen, but sometimes you look and you can just see the leukemic blasts, and you can even sometimes tell what the disease is, AML versus ALL. In this case, I looked in the microscope, and it was very certain that this was going to be ALL. There were lymphoblasts all over the place, and combined with the symptoms, I was 99% sure. You're not 100% sure until you have done the bone marrow and flow cytometry. This child needed to be admitted with the provisional diagnosis of new-onset acute lymphoblastic leukemia. I called the inpatient fellow and arranged for the admissions, and then I had to go back and tell the family what was going on. When you tell parents that their child has cancer, you learn very quickly that as soon as those words come out of your mouth, the test appears to show your daughter has leukemia. Parents often hear nothing else after that. Just white noise, panic, fear. So you learn very quickly how to get the key points across. The blood tests appear to show that your child has leukemia. Leukemia is a type of cancer. We are admitting your child to the hospital, and we will take extraordinarily good care of her. We know how to treat this disease. We will make a plan, and we will work to make her better. You have a million questions now, and we will answer them, just not now, because right now we need to focus on securing the diagnosis and taking care of your child. But we will take extraordinarily good care of your child. We've got this. We know how to treat this. You have to use the word cancer, unfortunately. You need to be unambiguous. And then you need to tell them that we've got this. We will take care of their child, and we will make them better. Anyhow, after that, the big machine kicked in. I wrote my note in the ER, wrote some admitting orders, and then the patient was transported up to the inpatient unit. Oftentimes, I'd never see the patient again. This was a very large tertiary care referral center. A couple of years later, I was in the elevator. I was now a third-year fellow, spending most of my time in the lab, occasionally taking calls or checking in on a patient of mine who was back in the hospital. That evening, I was standing there looking through some papers when I could sense someone staring at me. I looked up, and there was a woman there. So I said hello, and then asked if we knew each other because she did look a bit familiar. And then she said I was the doctor who saw her child in the ER 2 years ago when she was diagnosed with leukemia. I asked after her daughter. She was doing well, and then apologized for not remembering her, and told her I was surprised that she remembered me after 2 years, having only talked with them for maybe an hour at the time. And what she told me next has stuck with me for nearly 20 years. She said, "There's no way that I could ever forget meeting you. It's seared into my memory. I remember every word you said to me that night." It really shook me, and I told her that I hope I had done right by her daughter. She said I did, but it made me realize that as a doctor, and in particular my role, patients and parents sometimes hang on every word that comes out of our mouths, that we wield enormous power via our ability to instill hope or trigger fear or cause despair. While we may see thousands or tens of thousands of patients pass before us in our careers, patients may only encounter a few doctors, and for pediatric oncologists, sometimes very few. We make an outsized impression even with the smallest words or phrases. It also made me realize, this was before I was a parent, the depth of the fears that parents have when it comes to their children's lives, and how your being there when a parent senses that their child's life is in danger irreversibly imprints your presence on their memories and their lives. It is an awesome responsibility, and one that I feel privileged for having been given. I hope that whenever I've had to break awful news to parents and families, I've done right by them. OP has an absurd level of recognition here. Being able to fully come to grips with the impact you have on people's lives just when you see them in passing, that's important. And I think is the crux of bedside manner, which sometimes you don't always get from medical professionals. But hey, they're busy, it's a stressful job, sure. But all I'm saying is, if I'm ever diagnosed with something, if bad news has to be broken to me, I think I would want OP to do it. Next story. A patient of mine I hadn't seen in forever came to emerge because he couldn't manage at home. Too weak, losing weight. Blue-collar guy. Lots of coping with booze and smokes. I took one look at the 50-pound weight loss on him and knew. Doc, I think I'm on the way out, he said. Not going to lie to you. I'm worried about that too, I said. Massive lung cancer. Had spread to the bones and liver. He died 2 weeks later. Next story. Relief. When on a palliative care service in residency, a patient who knew her cancer had come back was hospitalized due to complications. The PAL care team was consulted to discuss goals of care. The attending I was with was the first doc to sit down with her and explain she was on her 4th line of chemo agents. Even in the best case as a first line, the meds she was on had a 30% chance of extending her survival. Hearing that let her give herself permission to not go through the misery of chemotherapy, and instead emphasize time with her family. It was a very emotional visit, but she kept just thanking the PAL doc for telling her outright what to expect. Next story. I'm not a doctor, but I worked in a nursing home, and there was a couple who lived there but in separate areas. The wife had Alzheimer's, so she stayed in the Alzheimer's unit, where none of the residents could get out without a code. The husband lived in a room down the hall from the unit. The husband had been trying to get permission to live in the Alzheimer's unit with his wife, but wasn't being allowed, I think by the nursing home. One day I come in and the husband asks me to help him look for his wife. I go inside the Alzheimer's unit and all over the building, but can't find her. Finally asked someone and they said she had died the previous night and that we weren't allowed to tell the husband because the daughter wanted to. I had to go back to the husband knowing that information and told him to stay by his room with no explanation as to why. He could barely make it off to go inside his room and tripped a little on the way in. He closed the door and as soon as it shut, let out the most gut-wrenching sob I've ever heard. The pain of his crying. Each time I've thought of this in the 20 years since, I can still feel the hollowness of that moment, and I always cry for them. His family wasn't there to tell him in person. He wasn't there for his wife in her last moments. He was just told in the cold hallway by a couple strangers in scrubs, not even in the privacy of his own room. I've never stopped being mad about it. His wife was a bit combative and not very lucid, but if you mentioned her husband and told her that he thought she was the most beautiful woman in the world, her face always lit up, like he was the one thing she knew in the world. Don't put your family in nursing homes, but if you have to, visit them as much as you can. No excuses. Next story. As an emergency physician, I have given a lot of bad news. You expect the yells, screams, cries, punching walls, and cussing. I once told a woman and her daughter that the woman likely had advanced pancreatic cancer. They had presented for the mom having jaundice and a lump in her upper abdomen. After I told them this, after the CT scan revealed a mass on her pancreas, the daughter and mom both cried and then hugged me and thanked me. They told me that the mom had come from a country in Southeast Asia and opened up a few donut shops and raised all 4 kids who had been successful in their careers, and that was all the mom wanted. She was glad that she got to see that. She was thankful that she had been able to do that, and that was the only thing that seemed to matter to her at that point. A few other people have also thanked me after telling them horrific news, such as the death of a family member or a new advanced cancer. Next story. I'm not a doctor, but I took care of an elderly patient who had a ruptured aortic aneurysm. I told the daughter they were in great hands and we will do everything we can for them. It was chaos. The parent coded before we could start the surgery, and the CPR we were doing was just filling their belly up faster with blood. After 40 minutes, they were pronounced dead. The doctor called her and told her her parent had died. She lived 2 minutes down the street and was coming to the ER. Doctor didn't wait for her. I had to meet her in the lobby, and I just hugged her while she cried. I then walked her up to her mom. We cleaned her up and took her to a viewing room. Her parent died, and a few hours later, my water broke. My daughter's birthday makes me think of that patient and their daughter. I hate bad endings. Hopefully it's not too insensitive to say this is very circle of lifey, though. It's just a fact of our existence that people will be lost and people will be born. There's no better example of that. I hope OP, instead of mourning the loss of this person every birthday for their daughter, manages to celebrate her life instead. Next story. Not a doctor, but I worked as a labor and delivery nurse for a while. One patient came in bleeding. She was 38 weeks pregnant and was advised to have a C-section because there was a concern that her placenta would detach, putting her baby at a high risk for a bad outcome. She refused and wanted to be induced to go into labor instead. After hours and hours of monitoring how her baby was tolerating labor, the heart rate plummeted and wouldn't respond to any intervention. We ran her to the OR for a section, and I received the most beautiful, perfect baby in my arms from the doctors, except he wasn't breathing or moving. I ran him to the neonatologists who worked on him while we closed up Mom. We had no idea, but really, we did, what was going on with the baby in the next room. We closed Mom up and took her back to her room. The doctor came in and told her, as well as her mom and her boyfriend, that despite their efforts, the baby didn't make it. She didn't even react, just her mom wailing and her boyfriend crying. It wasn't until I brought the infant into her room for her to spend some time with him that she broke. She looked at me, looked at her baby, and just started whimpering the word mama over and over again, too scared to take her baby from me. I quit that job 2 weeks later. This was 3 years ago, and I can still remember her face and her voice and that beautiful little baby. Next story. By far the worst was a night I was working in the emergency department about 11 years ago. 8-year-old boy brought in by concerned parents because, quote, he's sleeping a lot more than usual. Not a very common complaint, but we found out from history that he had been complaining about feeling unwell for a few days, and so they had been letting him sleep assuming he had some sort of mild illness. They came into the emergency department that day because he had slept 18 hours and had soiled himself and the bed, which was very unusual for him. On assessment, very lethargic, barely rousable, no fever or any obvious infection symptoms. Vitals were fine. We decided to do a CT of the head, and it was severe hydrocephalus secondary to a brain tumor, likely craniopharyngioma. In layman terms, significant brain swelling because of a brain tumor that was blocking the usual fluid, CSF, from draining from the brain. Prognosis poor per pediatric neurosurgery given location and size. Broke the bad news to his parents and his older sister, and I will never, ever forget the scream that came out of his father's mouth. Just a long, primal howl of anguish. Had to leave the room and cried in the men's change room for a bit before going back to talk to them about next steps. Was emotionally wrecked for the rest of the night shift, and for months afterwards, too. Tearing up a bit just writing this out. Next story. I had a patient, 80-ish years old, who was terminal, and her body was failing fast. Her daughter, 60-ish years old, brought her into the hospital because she was sure her mom had pneumonia and needed antibiotics. And then the mom would rally any minute and walk out of the hospital in a few days. Her x-rays showed her lungs were completely full. The daughter had been dutifully feeding her mom. However, since her mom's body had already started to go through the beginning stages of dying, she was no longer able to swallow properly, so her lungs were full of pureed food. I spoke with the son-in-law because I was trying to figure out the family dynamics so I could better help support the daughter through what was going to happen any day now. Turns out the mom and daughter had never lived a day apart. The mother went on the honeymoon with the daughter and her new husband and then moved in with them. So this grown woman with a child and grandchild of her own literally couldn't process her mother was dying and wouldn't be in her life anymore. I was there when the patient passed away, and I had to call the family to make the notification. I spoke with the son-in-law because the patient's daughter was driving to come visit the patient. When the daughter arrived at the hospital, I escorted her to the patient's room, and I have never heard a wail of grief like that. The family, her husband, and her own daughter were at a loss for how to help the daughter because she was inconsolable. Nothing in nursing school prepares you to hear someone wailing and begging their mother not to leave them. I was 6 months pregnant with my first and ended up crying in the break room while we were waiting for the daughter to be able to leave the patient's room and go home with her husband and daughter. My charge nurse was comforting me and was able to help me put myself back together enough to go back out and finish the shift. Isn't it insane that people like OP will get this absolutely heartbreaking, devastating scene in front of them and have to go back to work afterwards? These people experience tragedy every day and have to just keep on trucking. If it isn't obvious, I have nothing but respect. Next story. I've got several that really stick with me. I'll go with the least sad. I was on my neurosurgery rotation, and we had a patient that came in for a 2-part surgery. Part of her brainstem was herniating down and blocking a portion of her spinal cord, causing her to have symptoms throughout her body and nausea and vomiting. It's been going on for years, and she was extremely excited to finally have lost enough weight to undergo the surgery. Her whole family was there to see her off, but the last to say goodbye to her was a giant of a husband. 6'8" easy, 350 pounds of muscle. There was a lot of love exchanged in that moment and a lot of hope. We began the arduous first part of the surgery, which was 14 hours and was overall a success. She tolerated well as she was kept under and kept intubated due to the recent trauma. Plans to return to surgery in 2 to 3 days after she had recovered a little and her swelling had gone down. Unfortunately, some point in the next 24 hours, she had a dramatic increase in her intracranial pressure, and due to miscommunication from the nursing staff, she wasn't evaluated until the morning, whereas she had already experienced brain death. My attending and I performed the evaluation and confirmed brain death, and he instructed me to gather her husband and someone close to him for bad news. After pulling him into a counseling room and explaining what happened, this gentle giant proceeded to throw a chair into the wall. That thing was embedded 4 feet up and was halfway through to the other side. He then collapsed, screaming and sobbing. It took me another 20 minutes to slowly coax him into his wife's room, where he knelt by her side and cried for 4 hours. He wouldn't let anyone touch her until the next morning, when we were finally allowed to take off the ventilator. I don't think I'll ever forget his sobs. I'll never forget him thanking me, even though I didn't feel like I deserved it. Next story. My job is exclusively delivering the news of rare, incurable, and often terminal diagnoses in infants. I expect the crying, the anger, the fear. Of course it wrecks me, but over time, I've learned not to take it personally, and that someone has to deliver that news. One day I remember distinctly was a baby who was born perfectly healthy. As she was being discharged, they took one last set of vitals and found she had profound acidosis. She was airlifted to our NICU, and within hours, we diagnosed her with a rare mitochondrial condition that was universally fatal within the first few days of life. I met with these parents who just that morning were about to put her in the car seat to go home, and that afternoon were preparing to bury their newborn. As I had that conversation with the parents, they were tearful but calm. All they could say was how much they loved their child and wanted the best for her. Peace. I've never met a family so rational, so calm, and so accepting of an awful but inevitable outcome in such a short period of time. It was beautiful and absolutely heart-wrenching. Next story. Paramedic here. A year into COVID, a patient was on the phone with his daughter telling her he couldn't breathe. Daughter called the 911. By the time I got there, he was dead. Couldn't get him back. Called daughter. She was devastated. Kept saying she was just talking to him. About the same time, lady just diagnosed with COVID a few days prior. She is extremely short of breath. Says, hold on, I need to get my phone charger. I do everything I could do. She has a CPAP mask on and we're unloading her as she says, please don't let me die. I told her I'd try, but she had to keep that mask on. She wasn't looking good. She started crying. The seriousness finally set in. We moved her from our stretcher to the hospital bed. She died. They called it after about 20 minutes. Elderly lady in a bedroom to the left. Daughter said she was sick. She's in the room with her mother as she lay there lifeless, 80s. I asked her to leave the room so I could evaluate. Maybe she had a shockable rhythm, I sarcastically thought to myself. Of course she didn't. I did a couple things, and when there was a good spot, I went to update the daughter. She was begging me not to let her die. I said I would keep working. Went back to the other room. She comes over to me and then starts begging me to stop. Said she realized that's not what her mom wanted. We stopped. After a phone call per protocol, I made it as fast as I could. Elderly gentleman, nursing home. Had been checked on 10 minutes ago but wasn't warm. Flatlined the whole time. I knew he wouldn't come back. I tried for a good bit, but I decided to call it there. Nursing aide said, can't you just transport him? It looks bad on the nursing home if he stays here. I said, well, he died here. He's staying here. Police will help contact a funeral home. Honestly, the ones that piss me off are the ones I have nobody to tell because they were all alone. Not long ago, I had a bad car wreck. When we were in the ditch getting her out, she said her name and said she felt short of breath and couldn't feel anything below her hips. We got her in the ambulance, and she was still talking. Left scene driving lights and sirens. En route, she quickly progressed to slowing down her breathing, and I was getting equipment out for that, and then she arrested. Flatline too, so nothing really to work with. I was a minute away from the ER. ER was mad because of the change of patient condition, but obviously I had no time to radio them about the update. They worked for about 8 minutes, then called it, and I never even remembered her name. Next story. Pharmacist here. Had a patient ask for something for itching across her whole body. Elderly lady had tried everything and couldn't get it to go away, even Benadryl. I told her to see her PCP and have her liver enzymes checked. Fast forward a few weeks, she has imaging done, and they find a grapefruit-sized mass in her liver. I'll never forget the tears in her eyes when she told me the news. Next story. Not the news, but looked after an 18-year-old who came off a motorbike, given brain-dead diagnosis. Parents decided to donate organs. Mother asked for a 24-hour delay so anyone who wanted to say goodbye could see him. That mother greeted, explained, and comforted to at least 30 teenagers and young adults who came to say goodbye to her son. Strongest thing I've ever witnessed, and still makes me cry nearly 20 years later. Next story. Patient here. I don't remember what the stereotypically arrogant surgeon said exactly when she told me the pathology results were malignant, but it was very much like reading a textbook. Had I not already read the report and had the medical background I have, I would have left the visit not knowing I had stage 3 cancer. But when I had an unrelated visit for my baby with our family doc a few weeks later, doc came in and offered a hug. Offered to have one of the staff hold my baby if I needed space or to talk through any of it. That doctor has literally saved my life on multiple occasions and couldn't be any more lovely of a human about it. Patients give/send the good ones actual paper thank you notes. They don't hear about the good things they do enough. I now have no evidence of disease, the family doc is still amazing, the surgeon retired, and the baby grew up really fast. Next story. My mother had a massive stroke while on a road trip vacation with my dad. I flew out that day and stayed with her. She was in a coma but responsive the first 2 days when I'd hold her hand. The doctor came around often to check on her and give us an update. As the days went on, my mother became more and more unresponsive, and the doctor came around less and less. My dad and I knew what that meant. He'd make his rounds and skip our room in the ER. It was heartbreaking, but we understood because what could be done? After a little over a week, a resident and nurse came over and told us that her chances of survival were bad, and even if she recovered, she would never be the same. We made the tough decision to let go, and we slowly saw my mother take her last breath. Friends and family had sent us flowers, but we were on the opposite side of the country and couldn't take the flowers with us. The nicest thing one of the nurses on duty said was, "Those flowers are beautiful. I would love to take them home. Miss you, Mom." Next story. Not a doctor. My dad was sick for about a decade. His hospice doctor sat in a room telling my parents that when patients have a chance to overcome the symptoms he was facing, he'd offer XYZ as the next steps. And he was not offering that. My mom, in her fuzzy mental state, didn't understand he was saying that my dad didn't have a chance. He was being too polite for her to grasp it. I had to tell her in no uncertain words that my dad did not have a chance to come back. And the doctor looked at me with the most gracious look. I wish I hadn't had to do that in front of my dad, but my mom just didn't get it. I'm not alone in saying that I would rather the news straight up, right? Being quote-unquote polite and sugarcoating it does not sound better than just hearing what's up with me. Obviously, tell me with some level of empathy and compassion. Don't, as one of the other OPs said, just give me the textbook definition of what happened or what's wrong with me. But if you treat me like a human and tell me what's wrong, I would appreciate that a lot more. Next story. Telling a story from the other side. My sister was a paramedic for years and knew everyone at the local hospital. She started waking up with severe headaches and was quickly scheduled for a brain scan. On the day, she and the staff were talking and laughing. The staff were saying how they would have to look extra hard in order to find a brain in there. You know, friendly banter that my sister was joining in on. My sister had the scan and was taken into another room. My brother-in-law saw the staff talking amongst themselves and knew in an instant by their faces it was something serious. A couple of them were close to tears. My sister died 12 months later of glioblastoma. Next story. Not the doctor, but I was in the room because it was my patient. 7-year-old girl comes to our ICU from an outside ED after choking on a hot dog. After 45 to 50 minutes of CPR, they got a very slow heart rate back and sent her over to us. When she got to us, she had no brainstem reflexes, and her heart rate was so slow it was likely she'd herniated and was brain dead. The doctor sat with the parents and said very gently, "I think the most compassionate thing we can do now is to put her in your arms and let her go." Her mom was so stoic, likely in shock. Her dad was keening in the hallway. Next story. Worked in a hospital. We had a young woman around 22 who tried to take her own life. She was in a coma, and we had no clue if she was going to make it. She comes from an abusive household and was deeply depressed. She tried many times before, but this one was serious. She barely made it. While in a coma, her mom came to visit with a duffel bag and dropped it off. The girl eventually made it and woke up from her coma after 10 days. The first thing her mom said to her while visiting while I was in the room checking her vitals was, "I brought you your stuff. You're not going home when you get out of here. You cause too much stress for everyone. As of now, you can consider yourself homeless." I will never forget the way the girl looked. She looked so dead inside. There was no life in those eyes, just blank. When she asked where she was going to sleep, her mom just said, "I don't care, under a bridge," in the most spiteful way, and left. I asked her if she was okay, and she just looked at me with tears rolling down her emotionless face and said no. I will never understand how a mother could treat their child like that. The look she had on her face branded itself in my memory. Truly heartbreaking. Let it be known that if I were not being recorded while reading this story, I would have some strong words for the so-called mother here. But I really don't think she can be considered a parent, don't you? Absolute piece of subhuman garbage. Next story. Not a doctor, but I was a contact tracer in the beginning of the pandemic. My job was calling people and letting them know they tested positive for COVID. This was very early on, pre-vaccine, when hospitals were maxed out and people were dying by the thousands every day. It was really emotionally taxing and we had very little support. Most patients were terrified and wanted reassurance that they were going to be okay, which was something we tried our best to implore, but truthfully we didn't know anything. Many cried. Some died. We would call and check in on them and call an ambulance if their symptoms worsened. This was also when we found out that they had passed, usually by a devastated family member that was also sick. A silver lining, though, was the family we helped to escape a domestic abuse situation. A woman with several small children living with a violent boyfriend. She tested positive, and when we called to give her the results, she told us she was scared and needed help. We were able to send police to escort her and her children to a motel, paid for by the state due to her COVID status, and set her up with social workers and file police reports. It was a brutal time I think we have all collectively forced ourselves to forget. Next story. I work pediatrics. Got called to an acute C-section because the baby's heart rate was dropping intermittently in utero. The baby was delivered in green amniotic fluid, which means it emptied its bowels inside the uterus. Sign of stress and usually complicates things quite a bit. First 10 minutes were hectic, but nothing I hadn't tried before. Thought we turned it around. Took the baby to the neonatal ward, breathing on its own. All looked fine. Then, during intake with the nurse, baby suddenly turns. Labored breathing. Slow pulse. SAT dropping like a rock. After a few minutes, baby was intubated, but we just couldn't get SAT up. Looked like a little wax doll. We spent 6 hours in that room doing all we could. Had my neonatal specialist get up in the middle of the night and haul butt in to help. There was a midwife crying in the corner for a while. Parents were immigrants, spoke only a little of our language and a little English. I gave them updates as often as I could. They were so scared, didn't understand what was going on. They wailed like wounded animals when I asked them if they wanted the baby baptized, because we didn't know how this would go. So I baptized her. What should have been a beautiful baby girl, now a waxy doll stuffed with tubes and needles. First time for everything. 45 minutes later, she was on a plane on the way to the ECMO center in our country. She didn't make it. Next story. I was a paramedic. We had a call for cardiac arrest. When we arrived, we were met by his girlfriend. She said she woke up and couldn't wake him. They had both done H the night before. We determined he was too far gone to work on and told her, "We're very sorry, but he has passed away." She was a little upset, but asked us if she could have our rubber gloves because she wanted to dye her hair later that day. Next story. Before med school, I worked as an OR tech. One morning, we had a tragic case from a car accident with a 38-week pregnant woman. The impact ruptured the uterus, ending the baby. The father had missed his ride to work early that morning and had to wake up his fiancée to drive him in, and she got T-boned right after dropping him off. So, he completely blamed himself for the accident. I was tasked with bringing her from the ER to the OR, and then showing the family to the surgical waiting room. The father had been trying to keep stoic and strong the whole time, right up until the moment the doors closed, and the family could no longer follow. I've never seen in my life a man completely collapse the way he did in that moment. That was almost 20 years ago, and I can still hear the pain and guilt in his sobs. I ended up helping with the surgery to remove the deceased baby and repair the organ damage. And then I was in post-op checking on the mom's vitals when she woke up and started stirring. She was pretty bad off pre-op, so we weren't completely sure if she understood that the pregnancy was lost. She asked me if I was in the room during the surgery. I told her I was. Then she asked me if I saw her baby and how he looked. That was when I lost it. I told her he was beautiful and cried with her. Next story. ER physician here. I give bad news almost on a daily basis, but there's one time it stuck with me the most. I had to tell a wife that her husband, who was found unconscious at the local park, suffered a major cerebral bleeding and needed surgery, with the low chances of survival. With a 1,000-yard stare, she said, "But he just went to the park to walk the dog." Over and over and over again. We have little to no control over our life and death. It's something I know medical professionals experience every day, but that one hit me hard. Next story. Pretty late to the party, but I worked in the emergency room as part of my GP training. Plenty of heartbreaking moments and stories, unfortunately, but this one sticks by me for different reasons. I'd been seeing an 86-year-old woman, and we discovered a massive lung tumor on her chest x-ray when she came in for something unrelated. When I went to tell her the news, her first reaction was, "Oh, honey, that must be so difficult to have to give people that kind of news." She was a very sweet old lady, and her reaction sticks by me. The fact that even in that moment, she was thinking of others. Next story. We all carry graveyards. Many are punctuated with the wail of anguish that comes from a mother who's just been told. It sticks with you after the first one, and you know exactly what it is when you overhear it. By contrast, I recently had a teenage woman who had been declared brain dead after a surgical complication. Dad had spent the entire night there in a dark room praying with one hand on hers. He was the only one there when her body started to give in overnight, and I had him call everyone else. 15 minutes later, I watched her heart stop on the monitors from outside the room, went in, and with a hand on his shoulder said, "She's just passed. I'm so sorry." All I got back was a nod and a thank you before he went back to praying. That will stick with me for its eerie calm. I think he must have put himself in a near meditative state, right? Which is probably good when you're about to experience grief and you have a feeling you might. I'm sure he was praying and hoping for the best outcome, but judging by his calmness, he was probably prepared for anything. I'm sure that his daughter lives on in whatever way that means for him, and I hope that some level of peace has found him after this. Next story. Mine was early in my nursing career. Worked in the ER. We had a 2-year-old come in who choked on a cherry pit. The pit lodged so deep in his trachea that there was no way to save him. We worked on that kid for over an hour, and I think it was because even the doctor didn't want to give up. It's Dad's reaction that haunts me. He dropped to his knees in the middle of the hallway and just wailed. I remember going into the nurse's break room and joining my coworkers. We were all bawling. Next story. I'm a psychiatrist, so my conversations with family members have a different feel. I think one of my most dreaded conversations is discussing schizophrenia. First break episodes tend to happen as someone is around 18 to 20 and entering into adulthood. I hate calling parents and giving them this news. See, if your kids have cancer or some other severe diagnosis, people will circle the wagon, start meal trains, etc. If your kid has a severely misunderstood and stigmatized disease such as schizophrenia, major depression with psychosis, or bipolar, a lot of others will suddenly stop communicating with you. A time most necessary for support becomes one of the most isolating experiences ever. Next story. Not a doctor, but a midwife. Whenever a pregnant patient comes in with reduced movement, I hold my breath until we find the Houdini's heartbeat, but sometimes it's not there. The gut-wrenching cry of a parent being told there is no heartbeat is unmistakable. It gets me every time. Next story. Not as dramatic or heartfelt, but saw a girl in the ED, 16-year-old, for nausea and vomiting. Turned out she was pregnant. I assumed the pregnancy was unwanted because she was only 16. I personally also don't want kids, so my mind may have already been a bit biased. When I told her the news, I started off with, "I'm sorry, but it seems like you're pregnant." I thought she would be upset, but she was actually very happy. Her mom, who was sitting next to her, was also very happy. Now, I never make any assumptions about pregnancies and just break the news in a neutral way. Honestly, the way I should have done it in the first place. Okay, look. It's not my place to judge. It really isn't. I am shocked a 16-year-old would want a baby. That's all I'll say. OP's right about their approach. They should absolutely approach it completely neutrally because You don't know what they want. But for the record, I would have made the same assumption every time. Next story. Not a doctor, but posting in case there are doctors reading this who need to know that the bad news delivery is needed and appreciated, hard as it is. My grandma had cirrhosis of the liver from Hep C that she got from a blood transfusion in the 80s before they tested for that. She'd been receiving treatment for years to try and get clear enough to get a liver transplant, and even just a few months before her death, there seemed to be hope of that. Her mental health started to significantly decline maybe a month and a half before she was admitted to the hospital very suddenly. I wasn't with her when she was first admitted, but my brother and parents were. They spoke with several doctors about her prognosis and options. There was exactly one who was forthright enough to advise them to let her go, that it wasn't hopeful and would probably cause more suffering to try and save her. At the time, they thought he was a jerk. By the time she died, they all wished they had listened to the one doctor and were thankful he said what he did, and felt bad for thinking ill of him. She was there for about a week, if I recall correctly, and was unconscious/under anesthetic for most of it. I was there for the last 2 to 3 days when I swapped out with my parents. Every med they gave me for her had an adverse effect on another part of her body. I know one was kidney. It would call for a different med that also had another adverse effect. So many IVs and machines connected to her in that tiny room. She didn't look human by the end, much less like herself. All swollen and bruised with the liquid oozing out of parts of her body. I feel bad for the doctor who finally told us at the end that the things they tried had failed and she was basically already gone. I know my brother, sister-in-law at the time, and I were a mess, especially my brother. We were allowed to be with her as the support was turned off. The effects on her body were so drastic we couldn't do an open casket funeral, which shocked my parents, as she wasn't in that state when they left the hospital. Anyway, my family has always felt they owed the one doctor an apology and a thanks. He had our best interests in mind, and listening to him would have saved a lot of trauma. The only consolation is that my grandma would have wanted any slim chance to live, so her wishes were honored. Still, that doctor's approach would have been overall kinder despite the immediate harsh lack of hope. And I hope to have doctors who will give news like that when it's cold and hard and not met with thanks. It's a tough situation. When OP's grandma would have wanted to be tried to kept alive... What was that sentence? You know what I mean. When the grandma would want to be medicated, basically, it's hard to say that you made the wrong choice, to be honest. It would have been more merciful, perhaps, to follow the other doctor's advice, but I think the wishes of the patient themselves should maybe take priority. I don't know. Situations like this are so hard to navigate. Anyway, that's the last story for today. I interjected a bit less today because, it's a serious topic and I wanted to give the stories their own room. I hope I did that successfully. I also saw some comments about how I talk too much or the narrator's commentary interrupts the flow of the whatever. I want you to know your feedback is heard, appreciated, even if I don't necessarily agree. But for now, thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.